My name is Vincent and I'm a doctor who specialises in sexual health medicine. Gay and bisexual guys do sexual health really well on the whole. They're much more aware about vaccinations, PrEP, the need to use condoms, how to negotiate consent, and those sort of issues which are often ignored in the broader population. I think there are many benefits of looking after your sexual health generally. I mean, obviously it's good for people's own health to be engaged in sexual health care. And it's also important for people's sexual partners. So there's a degree of, I guess, social responsibility, and looking after your own sexual health is looking after the ones that you care about. So when it comes to seeing a doctor for sexual health care, it's really important that you find a doctor that you feel comfortable with. You have to be able to be really honest with that doctor about the things that you're doing and what your situation might be from a relationship point of view or from a sexual health point of view, so that they can give you really appropriate advice. The sorts of things that I might need to know is how many people have you had sex with? Have you used condoms? What type of sex have you had? Have you had anal sex or front sex or penile sex, vaginal sex, oral sex? What sort of HIV prevention strategies have you been using? And one important question is also, when did you last have sex without condoms? Because that may determine whether or not I need to provide you with PEP that day. There's been a lot of change in the area of sexual health in terms of HIV prevention. Not every doctor will be across all of that change, so it's important that you find a doctor that knows about all of this stuff. You know, people do often worry about, whether they might get judged when they go and see a doctor. But if you're going to see a doctor, I think you can pretty much assume that that doctor has already seen everything you could possibly tell them about. So don't worry about it. Visit emen8.com.au.